patient, no hazards. His eyes are closed. Please stay still, don't move. I'm here to help you. Activate ERP. Get back to me. Wake up. Wake up. Not waking up.
Yeah.
Over here, man. I'm playing it.
But I can't see from across your boat.
No. You must have been born after 1985. We're going to realign your head. If it hurts at all, let me know. Resistance, I'll stop. 1,000, 2,000. He's breathing. Come on down here. Put your left elbow next to my left elbow. Somewhere my thumb. Right over right. Thumb up. This is all review, right?
Yeah.
I'm just trying to review so you guys get more visuals of this stuff. So red roll there, way over there, against the desk. In those black pencil holders on the top, round ones. Airway's clear. Put the head back.
Right airway.
Come on. Sorry, brother. Just there. That's it, bro. Ooh, good throw. Measure, look, insert. Good. Put the other hand back. Good. Options on. You hurt yourself anywhere else, though, let me know. It's Tom here, buddy. 4-1. We should not hurt anywhere else, man. There's Sebastian, Mr. Franco. Who is this guy? That's too many cool names. I don't have even one cool name. Is that 3? Okay. Update 911. He's RTC. We're gonna feel your legs coming together here, Franco. So tie your legs up, buddy, just to make sure you're okay. This should be narrow, not wide. Don't worry, I was well covered. There's no leg injuries. I only need to have one tie at the ankle.
Okay.
Minimal, anyways. Okay. Get your look inside gently, put your hamstrings underneath it. You got him?
Yeah.
Shoulder, know that.
2. Put the tape in the test or there's another one?
Hold on, sir. Hold that fellow. I'll answer your question in a second. You're doing good, buddy. Just gonna measure this stretcher out. Scoop you up.
Okay.
Scoop you up. Watch me do this, people, if you haven't seen it.
Yeah.
Chandler, you can sit up for a second. Depends will be there, it's no big deal.
Just feet. Sweet steps.
Oh, that hurt my fucking knee. Oh. Okay. Watch what I'm doing, brother. It's very important, Glenn. Don't worry about that.
Okay. Oh. Okay.
Watch me do it. I will need help, but not right now.
Okay. Thanks.
Keep holding the head down. I want you to come here in a second. I want you to pull up. Not yet. Here. Your knees against the board. Pull up. Just gently, like this much. And then Daniel will push that board in.
Great.
On the opposite. Don't let go, Daniel. Go, Daniel. Go. Outside. Okay, put your knees against the board. Now he's gonna gently push up. You're gonna push the board in.
Okay. On the count of 3.
Push it in. Go. Good. It's enough. Now you go put your knees against that board. You're gonna reach across now.
Okay.
Gently reach across now. Gently, not very much, only like half an inch. Push the board in. Okay. Now be careful. I don't want any study. You need to click. It's not clicking.
There we go. All right.
Good. Come back over here, Daniel. Sense of urgency, son. Right over right, left over left. The opposite.
Opposite.
Reassess ABCs. Airway's clear. Breathing good. Breathing good. Pulse is present. Skin is good.
Great. Middle one first, or is it?
Yeah, right, bro. Come on. Can you do that?
Okay.
Reassess ABCs. Breathing. Breathing. Pulse. Skin. Keep holding that.
Yep.
Give us not where's my stuff? Where's my kit? Where's my auction thing? Thank you. I have. And where's my chair to go? Sorry, guys. Let's go. To the other opposite side. Okay, let's find Glenn. You're good. Okay. Put a blanket on, Glenn.
Great.
Cover him with a blanket. Just up to here.
There you go. Oh.
Hi. I don't swear ever.
It's the plastic
Never
glove.
swear. Not good for you. Give me back karma. High five people instead.
It's crisscross.
Crisscross, uppercross. we're done. Day 9, we're in the RTC. But oxygen's on, blankets on, tie the legs. Okay, hold this one. Now, watch what happens. Do the clamp, underneath the crevice the neck. This is what you're watching, people. On the count of 3, you're gonna let go of the head and push that in. 1, 2, 3, let go. Push it under. Okay, pull it back a little bit. Both hands. Don't eat hot all day. Okay, good. You got that? Relax. It's underneath them. Head is lifted up, so it gives it better for us to measure this. Now, come here, look what I'm gonna do. So I'm on, what side of the patient am I on? Left side. So I'm gonna measure with my left hand, palm facing me. So look at this. I'm gonna get over here on top of the patient. So look what I'm looking here is I'm gonna put my hand on the top of the trap muscle right there. See that? So the muscle ends right there, top muscle. When I come down here, I put my elbow down, I turn my fingers around, and I try to put all 4 fingers along here from the trap here, and I see which one hits his chin. He's a 3. See that? His key dimension is here. So I always use, don't make sure your hands are not at an angle. They go straight up and down vertically. Boom, boom, 3 fingers. I take those 3 fingers and I measure here. So 3 finger means 1, 2, 3. So I unclip this from the back. So from the back, I push this out and I pull this in and I click it. Okay. Now watch. I measured it from here, but then I actually put it on from here with the arm between my legs. Okay. And so now watch here. Get behind me. Get behind me. And right on top of me. Ready? So, are you watching this? Look, I push this through only a little bit. Then I grab this with 2 hands and I scoop it underneath my patient. And I form it around his chin. And I look for this dot in the center. Just keep your hands where they are, buddy boy. So, dot in the center. And the hook here was right across. Now watch what I do. So, you got that so far? So come a little bit closer, come over top. So here. Okay, so I grab this. Watch my hand, my thumbs here. See my thumbs here? 1 thumb. Watch my second thumb. I grab the base of my thumb here. So I got 2 thumbs on it right now, right? Now I'm gonna let go of this one. 1 thumb on it. Back to 2 thumbs. But I went from here to here. This is the key right here. From here to here. Then I can pull this on. Then I make sure that it's on properly. And then I keep watching it from here. I make sure that it's centered. And it's not super centered. It's slightly off, just a very little bit. But it's more so, what's really making it bad is that pad there. Otherwise, it's not too bad. Put it on pause. Okay. Hold it. Don't put it on pause, leave it. So I'm gonna fix this. Is that a bit better?
Yes.
Dot in the center, and these hooks across. All I'm worried about is the hooks are even. I'm okay with that. Pause. Can I help you out, man?
Yeah, man.
Side. Don't play that sword. So we can't kill. Come on down. You line your head. If it hurts, let me know. Resistance, I'll stop. Okay. You still with me, Gerald? Oh yeah. Right over right. Notice sense of urgency, folks. Right over right. Shift left over left. You got a good hold on him. I'll give you thumbs up here, please. Cover the urge. Good. Everybody's clear. Checking the breathing for effectiveness. I know your side hits. I'll get you in a second. How's that breathing of yours? Is it painful to breathe?
No problem. No problem.
10-liter flow non-rebreather mask. So focus on that, okay? Breathe that in slowly. It makes you feel a bit better. It's colorless, tasteless, odorless gas, okay? I'm gonna check you out here. I'm gonna make sure you're not hurting where else. So even if there's any pain, numbness, or tingling anywhere, okay? How are your arms doing, okay?
Yeah, they're good.
Wanna move that a little bit? How's underneath that shoulder blade?
It's fine.
How's your back doing?
Okay.
How's the collarbone? Anything else hurt?
No.
got underneath here. You feel me touching you here, man?
Yeah.
Yeah. Oh, that's where it hurts so bad. Okay. Go for that. Eye exposure. I notice there's some point tenderness, redness. Okay.
Am I bleeding down there? I can't tell.
No bleeding.
Oh, good.
No bleeding, buddy.
Oh, good.
So he says, oh, I feel like I might have to pee. Okay, well, you know, just you gotta do what you gotta do, okay? But you know, it's not the end of the world. You keep on saying that peeing in my back. It feels like we're gonna have to help us support this. You can't use my orange. Okay, just about 2 minutes in. Any pain, numbness to me in here? Let me know. You feel me touching your legs?
Yep, I'm good.
Okay. We're gonna get a collar on you, okay, buddy?
All right.
Get you out of here. Get that ETV ready. Where are those guys? Hey. Hey, Joe. We're gonna get the coffee thing. Sorry. The cowboy will lift you up, okay? 1, 2, 3. Let go, sir. Push that underneath your head. You okay with that? All right. Don't fall asleep on me right now, okay?
Yeah,
Okay with you, buddy. Sleep good, look on. There's always something. Song with everything, right? Okay. Corn beer. Okay. Down here. All that up there. How you feeling with that, man?
My ear's twisted.
Okay, so I'm gonna put the right or left.
Left one feels twisted. There we go.
No use in it. Is that okay?
Yeah, no, it wasn't twisted. Yeah, I was just turned, folded over. It's all good.
Okay, good.
No, now it's better.
You okay, girl?
I'm just whining because I'm hurting.
A secondary ear wound now?
Yeah.
My ears. Your pelvis is fractured. Wide at the top. Wide. Arm you with me, buddy. Okay. What are you noticing about me? Sense of
Urgency.
urgency.
Go, Tom, go.
So, we're going to do some distance either sides here. One, you bring, pull this up here and push it towards this leg. Pull this leg as well. You're going to push this one into this. So I have my knee there too. Good job. I'm not going to rotate his left leg at all. Once around, twice around. Okay with that, man? We're gonna reassess ABC's airways clear. Time to check the breathing again, man. How's that breathing, man? Painful at all?
Okay.
Still doing okay?
Yeah.
Okay. Got some incontinence going on. That's very real stuff, man. It happens. So, same thing here, same rules apply. About an inch below. I want it to just doesn't hit his head. Okay. There you go, there's that. So watch, this is very different. So I come here, there's a lever. Press it down and separate it. Then there's a little notch here. I pull this up. I unlock it, so pull it well. You should just hold it. Personally, you don't have to do that. I like to hold it open and then go past his feet. That's it. Once you go past his feet, I forget it. Jeez. I'm just past his feet. I'm gonna go this way. Okay. Ready, girl? Grab this, walk around. Grab it. Be careful, don't have them. Back away, everybody. So look, make sure you do this with your make sure the belts are going away from here. The buttons and kind of hook his foot at the bottom. Hug yourself, hug yourself. Hug yourself really tight, high up. Go ahead and hook the bottom. Don't do anything with your body, bro. We got you, okay? We're gonna do a natural push. Let me push into him as much as you can. Naturally, just like literally push underneath it as best you can. Look in the middle, ready? 1, 2, 3, push. Good. Now come over here. Now I'm gonna gently hold his legs and you're gonna click these together. Watch it. Just I'm not even gonna lift them. Just gonna hold them. Click them, grab the other side too. Gently. Good. Now let's go back. Now we're gonna do a natural push. This is called a natural push. Push it into him. Good. So now we're gonna do, you don't have to do anything, we'll do it for you, buddy. I'm gonna pull him and I want you to really push this middle part in. And push that in as well, okay? Alright. 1, 2, push it and push it and push it and push it and push it. Good. Good more. There you go. Now you do the same thing. Let's pull it just a wee bit. Just a little bit. I want just a little bit. 1, 2, 3. Good. Now come up here, we're gonna do this together. Look here, come over here. We're gonna push down. No. Stay here. Stay here, over here. Good. Down and in. Gently. Okay, good job. Okay, good. We're gonna reassess the ABCs, airway. Breathe for me, bro. Good. Yes. What do you mean? You're right. We're gonna do this pad right here. Or cross, help me out there, Julie. This one here. A little firm. And this one, even if you don't have this, it's not the end of the world. Yes, there you go. Look it in. Okay, good. Mr. Reds, Team Mr. Reds. Thank you. You're okay, Chief. Bring back up a second. Okay. So, my friend, this is you, Joe. You slide your hands slowly out of there. Stand up, walk around there, Miami, do it on the side. Oh, I'm close to your body. Bring it close to your body. Bring it close to your body. There. Do this, yeah. Yeah, got it. Nice and firm, buddy. Squeeze them together. Squeeze them together. Now, this is different. So now this time you have to use tape. When I say have to, it's a better choice. Close your eyes. Best thing, always you have to do it from up here as a first aider, and you always go from one side to the other. You go from let go time. Hey, can we help you out? Is that okay? Yeah. Okay, activate ERP. So the first thing is getting this. Look at this. When you can't do this, you gotta do this. Do it out. And where are you, Ray? Watch this, look. And then I do a long and a short. Okay, again, so my short can be in the air, left has to be anchored. Long has to be anchored. Long, elbow, turn on that side, short, waving. Okay, put the arm beside him, really close. Just go straighten his leg down there quickly, gently. Okay, come over beside him, grab his hip and his shoulder. Kind of through slowly, we're gonna keep the chin close to the shoulder. 1, 2, 3, slowly. Good, stop there. Put your left elbow in the middle of the chest, high up in the back of the head, higher up. Right hand, clamp on, squeeze it. You got a good squeeze, 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 squeeze. Yep. Listen. Good air exchange. And then I'm gonna crap underneath. Watch this. Switch there, and switch here. Out, here, here. If this one was here, I'd be screwed. Has to be back. This one's grabbing the shoulder. Go back to the shoulder and hip. Shoulder and hip. Count of 3, lay him down, bear his weight. Don't do it slow. Don't do it fast, do it slow. 1, 2, 3. Slowly, slowly, slowly. Good job. Elbows down. Oh, realign the head. Okay, hand off the head next point. Okay, so airway management. the most common cause of an airway blockage is your tongue. Yeah. So what happens is, imagine this is your mouth, this is your teeth, here's your tongue, here's your teeth, here's your tongue. When a person passes out, all their muscles relax. They pass out, they faint, behosh, they become unconscious, unresponsive, because they're not getting enough oxygen to the brain, or they have a medical condition. When that happens, so this is the teeth, here's the tongue. When they become unconscious due to lack of oxygen, their body becomes flaccid. Everything relaxes. So now when you put them, so this is when they're standing up. Their tongue falls when they're standing up. Their tongue falls. But when you lay them down, their teeth are like this, and the tongue falls back of the airway. So now, so no more of this. No air coming in and out. So now the person has a blockage. The tongue blocks the airway. So whenever they're fully unresponsive to us, hey, wake up, Annie, wake up, wake up. So they're not waking up to, they're not alert, A. They're not waking up to verbal, V. They're not waking up to pain, okay? And then it's P, then it's U, unresponsive. When they're unresponsive, we're worried about their tongue. Okay? So remember that. Anytime someone's unresponsive and are not fully alert and oriented, we're concerned about their tongue. How do we take the tongue off the back of the throat on a non-spinal patient? Head tilt, chin lift. 1, 1,000, 2, 1,000, 3. They have good air coming in and out. Airway's clear. Okay. So if the airway's clear, we want to, thank you. We want to manage the airway. So then we'll manage measuring, looking, inserting, listening, good. Non-rebreather mask, breathing, pulse, skin, rapid body. Update RTC, done. Pause. Hi. So we're gonna right now work on a person who's unresponsive, but this time they're a spinal patient. So, boom. Right? And they took a fall, they're unresponsive. So our primary concern, our priority is always still the airway. So when they're unresponsive, whenever I say unresponsive, what's your priority? Anytime I say what's your priority, the answer is always the same. The airway. The airway is always the priority. Right now, what's the priority? The airway. Because we can't live without oxygen. Oxygen can't get into our system without our airway. So the priority is always the airway. And right now we're going to talk about a spinal patient. So they took a fall. We're going to establish an airway by wake up, not waking up. We're going to establish an airway by realigning their head and then doing a jaw thrust. So thumbs underneath the eyes, finger angle jaw, push down, pull up. You don't have to pull up hard. If they're unresponsive, their muscles are very relaxed. It's easy to do 3, 1,000, 4, 1,000, 5, 1,000. The airway is clear. Come here, Nisha. Put your right elbow next to my right elbow. Put your thumb here. Put your finger here. So thumb here. The other thumb here. Finger here. So just push down. Do the jaw. Push it. Push down on this. Pull out. Good job. Don't move now. Listening. Good air exchange. The airway is clear, but it's not managed. So same thing. But in this time, in order to manage it, so if I can't see it here, what I would do is I'd go clamp here. And I say, move this hand back, just that one. Keep holding this jaw thrust. Then I would measure on the side nearest me normally, just so you can see it. I'm doing this. Measuring, looking, inserting. It works. So I took the first hand back to measure, and once it's in, do I need to hold the jaw thrust anymore? No, so I don't just say let go. I grab on this and move her hand back. And that's making sure that I understand this person still has a sensitive spine. Okay, that's good. A is good. Managed, oxygen's on, breathing, pulse, skin, rapid body survey, update 911, their RTC. Stop. A person who's in cardiac arrest. We found this person unresponsive in a chair. One person, no hazards. We took him out of the chair, laid him down. So you two gentlemen want to come over here, you two over here, because he's going to be sitting over here. So you're looking like that. We took them out of a chair, laid them down. One patient, no hazards. Activate the ERP. When I get there, their lips are blue, eyes are closed. Wake up, Annie. Wake up. Not waking up to verbal, not waking up to pain. Okay, we're going to tilt the head back. 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000. No breathing. Check the carotid pulse. 1, 1,000, 2, 1,000, 3, 1,000. There's no pulse. My patient in cardiac arrest. Call 911. I'm going to start CPR. Get me an AED. Can help her come down here. So, just sit here, watch what I'm doing. These are called chest compressions. Make sure you can see me. I'm going to teach you how to do this over 2 cycles. 1 and 2 and 3. Look at my arm, look at my leg. 8 and 9 and 10. 2 inches all the way down. 4 and 5 and 6 and 7 and 8 and 9 and 21. And look at my arms aloft. 5, 6, 7, 8 and 9 and 30. Watch me do 2 breaths. You don't have to do this. Landmark properly underneath the arm, middle finger in the middle of sternum, elbow, heel. 1, 2, and 3. Think you can do what I'm doing? Yeah. 1, 2, 5, 6, and 7, 8, and 9, and 10. Count 1, and 2, and 3, and 4, and 5, and 6. Good job. 9 and 20. 1 and 9 and 30. All right, come here. Go ahead, landmark. Watch what I do after he's trained. Good. 1, 2, 3, 4, 5, 6. Very good. Put the airway in. The oxygen on. 5, 6, 7, 8, 9, 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. Keep going on. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 1, 2, 3, 4, 5, and 6, and 7. Look what I'm doing. 9 and 20. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 30. Keep going. 1, 2, 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10. Put my hand up. 1 and 2 and 3 and 5 and 6 and 7 and 8 and 9 and 30. Stop. Good job, man. Thanks. Stop that. Hazards.
No hazards.
And when I get there, I see that their lips are blue, looks like they might have been sweating, eyes are closed. Yeah, you can record this if you want. One patient, no hazards. But I'm also gonna make a group, a WhatsApp group, and I'm gonna split up into 2 groups. I'm gonna send you the videos. What? You can't share with anybody. Don't get all weird ideas either. Okay, here we go.
Fine.
I'm not gonna do anything, he's already dead.
My brother from the other mother.
There you go. Okay, so
No hazards, 1 patient brought to the ground.
okay, activate ERP, get back to me.
Yeah.
Don't bring in until I'll let you know. Yeah, bring it in. Okay, Annie, wake up. Can you hear me? Activate the ERP, please.
And
She-
she's not responsive to the voice.
Okay. Listen to her. She's good. No response?
No
How
response.
about to touch?
No.
No?
No response.
1, 1,000, 2, 1,000, 3, 1,000,
And he's not breathing.
1, 1,000, 2, 1,000, 3, 1,000, 5, 1,000.
And he has no pulse.
Okay, my patient cardiac arrest, call 911, let them know. Somebody bring me an AED, not yet. I'm gonna start CPR. Okay. This one, come on here. Sit right beside me. Open up that bag. There should be a razor in there, simulate the razor. Above her right
And he's
chest.
really hairy.
Never know. Yeah, and then give me a towel, dry her, dry off. Focus on what I'm doing. Focus on what I'm doing. I'm giving someone, to dry her off. Good. Now, open up. I'm going to take that box out, that plastic box. Press the green button. Put it beside me. On side yours. On the hip. Good. Show me those pads. Take one out. Peel it. Show it to me.
Next to flashing light.
When you plug that adapter in,
Plug in
go sit over
connector.
there. Across it.
Analyzing heart
Make sure
rhythm.
you can see it. Sit across from me.
Do not touch the patient.
Don't touch her. Back off. Good, good.
Clear.
I'm clear. clear.
Shock advised.
Don't touch them. Look what I'm doing.
I'm clear.
Charging. Stay clear of patient.
I'm clear, you're clear, we're all
Deliver
clear.
shock
Back
now.
off, back off.
Press
See what I
the
just did?
orange button now. Shock delivered.
Equanimity.
Begin
Watch what I do
CPR.
here. A landmark here.
Alright.
Feel my hand? Take my legs up. 1 and 2 and 3 and 4 and 5 and 6 and 10. Count you. 1 and 2 and 3 and 4. 2 inches straight up to Mars. 9 and 20. 1 and 2 and 3 and 4 and 5 and 6 and
7, 8, 9.
9 and 30. I'm gonna give 2 breaths. Don't do anything yet.
Yep.
I'm gonna teach you over 2 cycles. Look how I landmark. Walk, walk. 1 and 2
3 and 4 and 5 and 6 and 7 and 8 and 9
and 10.
1 and 2 and 3 and 4 and 5 and 6 and 7, 8, 9 and 10.
You can do it on me. You can do this.
Yep.
9:30. Go ahead. Landmark. Go loud. Okay. Keep going. Look, I let her breathe. Look, she's breathing. Come close, man. Why do you have to be? Why do you want to look at her back? Come over here.
I'm in the way, sorry.
So when she says 26, when they say 26, I start getting ready. 6. Look, I'm letting my patient breathe, keeping the mask off. Look where I'm sitting. 23, 24, 25, 26. See, I leave very little time in between compressions. Come on down here, Dave, quickly. Put your knees. Elbows on your knees. Put the head back. Help me out. Squeeze it.
Analyzing heart rhythm.
Good job. Thank you.
Do not touch the patient.
We're going to start off with the scenario where a person we found is unresponsive. Looks like they might have had chest pain earlier. One patient, no hazards. We found in a chair, we laid them down. Somebody said they weren't feeling well, clutching their chest earlier. We laid them down gently, and then they called us. One patient, no hazards. That sounds serious. Somebody said they're pale, sweaty, blue. Activate the ERP, get back to me. Okay. Hey, Annie, stay still. Upon approach, she's unresponsive to my verbal. We already activated ERP. Okay. Wake up, Annie, wake up. She's not waking up to my verbal, not waking up to my pain. Wake up, not waking up. Priority is airway, head tilt, chilling. 1, 1,000, 2, 1,000, 3, 1,000. No breathing. 1, 1,000, 2, 1,000, 3, 1,000. There is no carotid pulse. My patient's in cardiac arrest. I have an AED here. And Emma, I want you to come sit by here and just help me out. Just sit about a foot away from the patient for now. Okay. I'm gonna expose the chest. Hairless, dry, press, pads.
Apply pads to patient's bare chest. Plug in pads connector next to flashing light.
Okay, doing great, Emma. Just hang out there, Annie.
Apply
We're gonna
pads.
place this.
Analyzing heart rhythm.
Don't touch the patient. Everybody stay away.
Do not touch the
I'm clear.
patient.
You're clear. We're all clear. Take this.
Shock advised.
I'm
Charging.
clear. You're clear. This is hard to do.
Stay clear of patient. Deliver shock now.
Don't touch the
Press
patient.
the
Back
orange
off. Stay away.
button Now. Shock delivered.
Okay, Emma.
Yep.
Begin
I want to teach you how to do compression. So
CPR.
underneath the armpit, middle fingers, heel, interlock, 1 and 2. I need to take care of this for 4. So listen to me, 5 and 6 and 7 and 8 and 9 and 10. 1 and 2 and 3. 2 inches all the way back. 8 and 9 and 20. Count with 1 and 2 and 3. Good job. 30. So you won't need to do that part, but you do need to do this part. Underneath
Okay.
the armpit,
Yeah.
Fingers in the middle of the sternum, interlock, heel there.
Yeah.
1, look at my legs with my arm.
Yeah.
4 and 5 and 6 and 7. Lock the elbows. 9 and 10. 1 and 2 and 3.
3 and 4 and 5 and 6 and 7 and 8 and 9 and
20.
1 and 2 and 3 and
Get that. I love the cadence. You got it.
7 and 8 and 9 and 30.
Get ready, come close.
Yep. Lining up under the sternum center.
Good job,
Just
here we
1
go.
and 2 and 3
Look
and
at
4
you.
and 5, 1 and 2 and 3 and 4 and 10, 1 and 2 and 3 and 4 and 15, 1 and 2 and 3 and 4 and 20, 1 and 2 and 3 and 4 and 25, 1 and 2 and 3 and 4 and 30. 1 and 2 and 3 and 4 and 5, 1 and 2 and 3 and 4 and 10, 1 and 2 and 3 and 4
Great
and
job.
50,
Look at my
1 and 2
hand.
and 3 and 4 and
The left.
2 and 3 and 4 and 30. 1 and 2 and 3 and 4 and 5. 1 and 2 and 3 and 4 and 10. 1 and 2 and 3 and 4 and
Come close, Rod. Where's the bar?
2 and 3 and 4 and 25. 1 and 2 and 3 and 4 and 30. 1 and 2
Look, I'm letting her breathe in and out here.
1 and 2 and 3 and 4 and 10. 1 and 2 and 3 and 4 and 50. 1 and 2 and 3 and 4 and 20. 1 and 2 and 3 and 4 and 25. 1 and 2 and 3 and 4 and 30.
Analyzing heart rhythm. Do not touch the patient.
Mark.
You can start anytime.
Chest compressions. 1 and 2 and 3, 4, 6, 10. 1. Go, please stop. I have 5 trimmers for you. Sound. Not waking up. Come down here. Number 2, kickstand. 3rd, direction. Knees here. Hands across. Fourth, long. Short. 5, lateral. 1, 2, 3. Good. And now put your left hand across, higher up on the head, clamp on. Okay, good. Don't close your mouth. I still gotta get your mouth to mouth. Let's bring it towards more.
I was just looking where your other hand is.
Well, you can't.
Cheekbones.
Why don't you walk around, though? Like, you know, what a concept. Sweep it. Sorry, not just you, Kyle. Everybody. Like, if you're missing this, come close, because I'm expecting mastership. Sweep. Use it.
Pump, pump. Pump, pump. Second.
Don't actually do it.
Oh, little kisses, sweet. Look. Okay, go back to the shoulder.
Ready?
Yep, 1, 2, 3, go down. Sweep, realign. Jaw there.
You okay?
Yeah, help her.
You okay?
Right side. Left over left.
Sorry if I'm hurting you.
I was shopping for a Lloyd. Mike, wait. I was shopping for a Lloyd. My brother long time too. It's the same shampoo for over like 20 years.
Hey, if it works.
Working. Stop. Release. Move your hand back. Good. Measuring, rocker, do listening, exactly. Move your hand back. Listening. Turn on oxygen here. Breathe, goddammit. Breathe!
You caught a normal airway in. Breathe. You're breathing.
Are you doing this one again?
Yeah, come on, go.
But in 0.5, so it's more.
Okay, condense?
Fish eye.
Yeah. More.
But do you really want to do that? Do you want to stand up and do it?
No, because I have a better.
Right, here we go. It's fine. You can just make sure there's, yeah, shut up, Tom. What happened here? So that one was electrocution. Hands. This one is drowning. But look, they're the same, except one is wet and one's burned. Okay, so she fell into ocean water, face down for 5 minutes. We pulled her out. She's blue cyanotic gas, blue cyanotic, unresponsive. Activate ERP. Get back to me, please. Help me out, Giorgio. Giorgio. Don't start it, please. Don't start it.
But I was helping you.
Oh, you never. Oh, there's help. Sorry, Giorgio. Sorry,
Oh, shit.
I'm easily distracted.
Alright, I got it.
All right, so near drowning, one patient, no hazards, activate ERP. Hey, Grace, wake up. Not waking up to verbal, not waking up to pain. Lara, come here. Grace, come on here. On the other side, Lara.
Oh, Jesus. I was always told left.
Reline. I work from left. See spine. Come on here. 1,000, 2,000. No breathing. So make an over exaggeration of letting go. Do you have one hand or you're allowed to do that? Pulse is present, 3,000, 4,000. Come back over here, Lara. Right over right. Bring it down here. Airway's clear. Breathe for them. Breath. Breath. The 2 breaths go in. Move his hand. Move that. Okay. Breath. 1, 1. So that's important. I gave 2 breaths. Then I put the airway and now I train. Move your hands, pretend it's their face. Normally be like this.
Yeah.
I have to breathe that last since 1987. Take 2 breaths. Breath. Breath, 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000. Breath, think you can do what I'm doing?
Yep.
Count with me. 1, 1,000, 2, 1,000,
3, 1,000, 4, 1,000.
and breathe. Okay, good. Flow.
1, 1,000.
Now, the most important thing is you get a good seal
Four,
and you don't
1,000.
miss your breath on
Blow.
after 4.
1,
Excellent.
1,000.
Blow.
2, 1,000.
My help was effectively
3,
trained.
1,000, 4, 1,000. Blow. 1, 1,000. 2, 1,000. 3, 1,000. 4, 1,000. Blow.
Wow.
1, 1,000. 2, 1,000. 3, 1,000. 4,
Even though it's still on
1,000.
here, you still have to keep breathing for them, okay?
1, 1,000. 2, 1,000. 3, 1,000. 4, 1,000. Blow. 1, 1,000. 2, 1,000. 3, 1,000.
Blow.
4, 1,000.
Blow. Sorry.
1, 1,000. 2, 1,000. 3, 1,000. 4, 1,000. Blow. 1, 1,000. 2, 1,000. 3, 1,000.
Sternum must be hard. Ribs need to rise evenly and fall. Right? Tummy should be soft. And then I do a sweep and a look. So 1, 2, 3, 4, 5. Now go to A. Airway. Breathing. Breathing. Well, Radial's absent here. She's blue, soaking wet. Radial's absent there. Claude is present. Skin feel coming blue, rapid body survey. When I get down, oh, she's soaking wet, her pants. We're gonna complete.
1, 2,
Okay. When I see Peter, his lips are blue. He's can't breathe. Like that. You can only get 1 or 2 words in between each breath, and he's gasping, labored breathing. Dyspnea, that's what it's known. DYSPNEA class. Pete, stay still. Activate your P. It's safe. Activate your P. Pete, stay still. Tom here. Is it okay if I help you out? Don't shake your head. Keep looking this way. Follow me, buddy. Come back here. Oh, right away. Check in on the back. Nothing on the back here. Okay, good. Yeah, come back here. Support. Okay. Okay, you're doing great. Thank you very much. Count a few later now. 1, 2, 3. Good, Thomas. Okay, back up, buddy. Back on up there, okay? Put your elbows to the ground. Thumbs in the middle of the forehead. Okay. Pete, I know you're hurting, buddy. We're gonna get to it in a second, okay? I gotta help you breathe here, man. I'm putting a mask on your face here. I'm not really gonna. We're gonna help you breathe, okay? So let me breathe for you. When I say 4, I want you to inhale together. Let's work as a team here. So when I say 4, I want you to breathe in 1,000, 2,000, 3,000, 4,000. Inhale, breathe. See what we just did there? Let's do it again. It's got to get a really good seal on his face here. 3,000, 4,000. Breathe. Think you can do that? So get a really good seal. 1,000, 2, 1,000, 3, 1,000. Inhale, 4,000. Breathe. 1,000, 2, 1,000. Get a good seal. 3, 1,000. When I say 4, breathe in. 4. Breathe. Okay. Every time we say 4, so we're actually breathing 1 every 5 seconds. After you say 4, when he breathes in, you breathe with him. Breathe. 1,000, 2, 1,000, 1,000, 4, 1,000. Breathe. Breathe. Help her keep a good seal, and don't forget to breathe for him. Okay. We're doing good. Slow. Breathe. Slow. Do I need an oral airway for this person?
No, he's conscious.
Peter.
No.
Conscious?
Probably not gonna go in. He's gonna fight that one.
Blow. Blow. Breathe. I'll flow. Breathe. Breathe. Okay, oh boy. I mean, you look good, not too bad. You got an open hemothorax here. Okay. Hand me that orange sandbag, buddy boy. Look underneath here. Right away, nothing. Thank you. Oh, Mr. Orange, hold on. Sternum is hard. Ribs are rising now. Tummy is soft. Nothing underneath. Okay. Now we start with A. Listen for A. He's not vomiting. Good. Breathing. Rise and fall. Breathing. Rise and fall. Pulse. Skin. Rapid body survey. Rapid body survey. Nothing else found. Update 911. RTC. Collar, tie the legs. Hey, we got a person here. Cough. Who's coughing, so it's a partial obstruction. He's conscious. One patient, no hazards. Activate ERP. Cough. Tim, Tom here. Here to help you. Is it okay if I help you out? I notice you're coughing. Are you choking on your lunch? Okay. What you want to do is do exactly what you're doing. Don't really cough. Say the word forcefully cough. Cough. Good. Activate ERP, call 911. As long as you can cough, we're doing good, man. It's okay. He's still coughing forcefully. He starts to change color. He starts to turn red. I mean, more red than he normally. Get down on the floor here. I wasn't trying to funny. Lay down. Just don't. Make yourself, because he's turning red, I want to give him oxygen, right? But he's starting to turn pale now. So when he starts to change color, I think, okay, let's give him some replacement oxygen. Just relax, you don't put your face, he knows he's been there. Airway's partially clear, breathe for me. Again. Okay. You hurt yourself anywhere else at all? All right, so we need to get you to stand up. Okay, walk up to the vehicle, sit in there. Take the oxygen off him. Put your seatbelt on. He's got a partial obstruction. There you go. And now we got the seatbelt on. We're going to start our secondary survey. Here is a person who's choking and has a complete obstruction. And clutch your throat and they're coughing. Say cough.
Cough, cough,
One
cough.
patient, no hazards. So, Osiris, it's Tom here. Are you choking on food? Activate the ERP. Okay, call 911. As long as you can cough, we're doing okay. So forcefully cough.
Cough, cough,
And
cough.
all of a sudden he starts shaking his head. You can't cough, you can't breathe, you can't speak. Lean forward. 1, 2, 3, 4, 5. Usually it comes out by then, but if it doesn't, you get behind the person.
Sorry.
You go around. Maybe when you landmark and you go 1, 2, 3, 4, 5. And if it still doesn't, keep it this way so we can watch you. Lean forward. 1, 2. Usually it comes out, but if it doesn't, now watch my landmark. I find the iliac, come around the front to the navel, put your thumb inside the fist. I have to do a backwards J. Boom. You got it out. Okay. And you can pretend this is not a vehicle, it's just a chair. Sit down. And we're gonna there's some oxygen. Got there. He's good. B, C, pulse, shock, skin. Any patient in anywhere else? He says no, but I also did apply a lot of force in here. So I want to see if the tummy is hard or soft. I also want to see if he feels back. This is still a modified rapid body. It's not a full hands-on. It's modified to the isolated areas that might feel some pain. Okay, and then from there, depending, if they're in shock, they're RTC. If they're not in shock but they're in pain, they're non-RTC. The secondary next here. If they're no shock, no pain, this is one of the only other scenarios, there's a few of them, where even if they don't go to medical aid, we do a secondary. And this is one of them where they had a partial obstruction, became a complete, and you cleared it, then depending on your findings. If they're in shock, RTC, secondary en route, pain in the tummy or back, non-RTC secondary here. No pain, no shock, still a secondary, 30 minutes of rest, then we'll make a decision. There's obvious gurgling. When you approach a patient, it's obvious to you that there's teeth and blood around the mouth. And the gurgles also may inhale, all of a sudden their thing goes, look over here, Tim. Okay, Blondie will be there later. Okay, your head, your chest caves in. So they go, so they're bleeding from the mouth. They start inhaling their blood. All of a sudden they go out, and all of a sudden their system reacts with go in, and they go out again, and they spit out fluid. So boom, boom, there, boom, boom, there. Like they do, boom, boom. They do that, and a couple of those, almost for sure, they're probably going to get pneumonia, which breaks your immune system down pretty badly. And if the person's not healthy as it is, can lead to a stroke and all this other, stuff. So it's pretty scary. So when you start off going, oh, they're just choking on their fluid, that can become a pretty big deal pretty fast. So we don't want to, miss. We don't want to miss it too much. Stand up then. So struck in the face. You don't want to be over here, Rich. Actually, you know what? You stay there, Rich. I'll do this for you here. How about that?
Gotta get the mannequin. So far.
So I got my goggles on. I got gloves on. Okay. Come on, Andrew, help me out.
Sounds good.
Stay still. Don't move, Annie. Wake up, wake up. She's gurgling on fluid. I try to wake her up to verbal, to pain. Nothing. Pick up her arm, and I put her arm here. I tell my helper to stand up quickly. So you wanted to sit where you were. I made it so you sit here. Put your knee here, Andrew, quick. Put your knee here, Andrew, quick. Now, so put your hand here, put your hand here. Got my left here, look long, short. Count of 3, put it on the side. 1, 2, 3, pull towards you, pull towards you. Good. Towards you some more. You put your left elbow in the middle of her back. Left elbow, middle of her back. Left hand across her head, way up on her head. Right hand, clamp on her cheeks. There you go. Maybe put your hand down like that, and put your elbow on your knee. Good. You can put your hand right like this underneath. There you go. Now hold on to her head. There you go. Okay. Now I can let go. Come down here. Come down here. Sweep out her mouth. Sweep out her mouth. No, I'm gonna sweep it out. I'm just telling. I was telling him. Sweep it out. I'm gonna suction it. I only put the catheter to the, as long as I can see the end. Do 4 or 5 sweep. Listen. Good air exchange. Oh. Here we go. Back in here. Go back to the hip and shoulder. Count deep again. 1, 2, 3. Elbows to the ground. C-spine. Realign. Jaw thrust. Listen. 1,000, 2,000. Good air exchange. Come over here, please. Right over right. Elbow on the ground. Left over left. Elbow on the ground.
Yep.
You got it?
Yep.
All right, now the airway's clear. But it's not managed. Clamp, back, measure, look, insert. It's in. Airway's clear. Airway's managed. Move both hands back. Airway's clear. Airway's managed. A's good. Oxygen. Intervention's on oxygen. A, B, C, C. Rapid body. Update, collar, tie the legs. One patient, no hazards. I have my goggles. Okay. I have activate the ERP. And pen, stay still. Goggles on, pen, stay still. Don't move, my friend. Wake up, wake up. So notice the equanimity here, not panicking. Wake up, wake up. Pain, nothing. This is called a kickstand. Okay, this is gonna help him so he doesn't roll all the way over. Come on down here, give direction to my helper. About 6 inches or 5 or 6 inches from the body. Knee here. Reach over here. Get close. Yeah. Over here, brother. Over here is where you want to be. Over here is where you want to be. Grab the hip and shoulder. Now I do my L shape here. I get my long and my short. And the count of 3, grab the hip and shoulder. Slowly put them 1, 2, 3 towards you.
That's gonna be it.
Oh yeah. Oh, come on. He's resisting.
Oh, you're resisting?
Give deadly. 1, 2, 3, go.
Okay, that's not dead weight.
He's
resisting his hips down.
No. Stop.
Sorry.
I'll be the helper next. 1, 2, 3, go. Good. Now, he's like, we were joking, you're not small, okay? Put your left elbow in the middle of the back, high up in the back of the head. Okay, now clamp on the chin. Okay, brother. Good. You got a good hold on him. Okay, good. Now, move. Sweep out the mouth. Do the suction. Only so far as you can see it. Sweep the mouth. Listening. Good air exchange. Good air exchange, Sonia. Now, back in here. Back to the lungs. So he's breathing now. Go slowly back to the hip and shoulder, sir. Count to 1, 2, 3. Okay. Put him down, brother. Stop. Now realign the head and neck. Now notice where my finger, I'm not really performing jaw thrust, but look. Right by the earlobe, slip down to the angle. Okay. Okay, buddy. Listening. Breathing. I can hear him breathing. I can watch the chest. Good. I got it, jaw thrust here. Come on down, brother. Put your right elbow here. Your thumb on my thumb. Good. Here. Good. That's clear. Make sure he's breathing. Doing a good jaw thrust. Okay. Now we're going to have to, I'm automatically going to skip to an 11 for this guy. Because I know it's going to, well, yeah, you have to kind of use your discretion, right? That's what I'm gonna do here. We're good. Let's straighten that head. Back this hand up, and we'll see if this 11 fits. Might even be a 12. Oh yeah, he's a 12, dude. Jesus. Yeah. Okay. I mean, we'll see if a 12 fits him. So, angle is just barely fits him. Okay. Then we simulate, pretend look in the mouth. We're not going to. And then put it backwards. Rotate it. Is it accepted? Is it working? Yes. There you go. Getting oxygen. You're unconscious, bro. And the airway is clear and it's managed now. So if I move the other head back, yeah. Breathing. So watch me do the breathing. Wait for it to rise and fall. Good. Underneath. Because you'll be doing on each other this morning, okay? Feel that pulse. Make sure you feel it. Temperature. Rapid body survey. Gently lift. Feel. You can straighten the leg. Wow. I'll take 911.
Taking it all its energy.
He's just huge, this guy. He's the Asian Dolph Lundgren. That update blanket. I don't care which order you do this. I'm really big on the blanket at the end. A lot of people get, it's only a 5-star, it should be a 15. But most people forget to do. Just remember, even if you know, do for a second. I got a blanket, even if he's hot today, just be like, I got a blanket on, then you can pull it off. Okay, and that's where we're going. That's better. I think this is no breathing. Without a pulse. Back to the jaw thrust. Go down here, Corey. What do you need me to do? Right over right. We're top left. We're top left. We're top left. Thumb here underneath. Come on, man. You're hurting her.
Okay.
Breath. You can still be a her.
Oh yeah. Nowadays, yeah.
I'm still saying this mustache.
So we got. So she's not breathing right now. She's got a pulse. So our first thing, we want to make sure the airway is clear. So we're going to give a couple of breaths. Breath. The breaths are going in. Keep holding the jaw thrust. Let one hand go quickly here. Measure, look, insert. Now I've managed the airway, and I go back to breathing for it. Put your hands up here, get a good seal. Breathe, watch what I do. 1,000, 2,000, 3,000, 4,000. Breathe. We're going to breathe for her because she's not breathing on her own. We're going to give her a good seal. 3,000, 4,000. Breathe. Think you can do what I'm doing? Count with me. 1,000, 2,000, 3,000, 4,000. Breathe. Think you can do what I'm doing?
Yeah.
Continue on. Keep
Yeah.
a good seal. Airways managed. Mask is sealed. Helpers trained. I'm monitoring. Chest is rising. Helper's doing a good job. Blow. Now I want to give her more than 17% oxygen. That's all my helper's able to give her. She needs more because she's blue and she's not breathing. She's got a pulse. Flow, 10-liter flow onto the pocket mask. Now I want the respiratory system is right here. I want to look at that. So I'll do this and I'll do 6 things. I'll do number 1, do visual check, any obvious injuries. Number 2, make sure that sternum is hard. Number 3, make sure the ribs rise and fall evenly. Number 4, make sure that tummy is soft. Number 5, sweep. Look at your hand, no obvious blood or injuries. Now you go back to A. Airway's clear. We already know the breathing's good. Radial pulse is absent here. She's soaking wet. Absent there. Carotid is present. Make sure I feel it for a couple of beeps. Good. Skin is pale, cold, clammy. She's frozen. Rapid body. Get some blankets on her in a second here. Keep this person warm. Oh, she's soaking wet on her pants. So we're gonna cut off that. Look for obvious injuries. Okay, and then because we're gonna make sure that we keep her extra warm. And she's got no pants on now. Update 911, my patient's RTC, collar, tie the legs, RTC. Okay. Well, who wants to help me out? Want to help me out? Okay, good. She's done it a few times, so give you guys a chance to watch it. That's what happened. One patient, no hazards. Activate the ERP. You wake up, she's got burns all over her hand and leg down there. Wake up, now waking up to vertebral pain. I'm gonna realign your head first so we know. C-spine. Jaw thrust, 1,000. And I noticed before 1,005, there's no breathing.
Check the cardiac pulse.
Oh, I love this. Osiris, you're in, buddy. So look what happens. Get close. Come close. Don't miss this. And she's not. What is the maneuver I'm holding? So I went from C-spine 2A.
Jaw.
Okay. And I squeeze that. No breathing. And I check and I slide my hand down. I check the pulse. She has a pulse. Back to the jaw thrust. Who's my helper? Oh, sorry, family. Yeah, come over here. Right over right. Go. Left over left. There you go. Elbows are down. Good. So our patient's not breathing. So normally we would put the mask on their face like this. Okay, and so we'd go breath, breath. The breaths go in. When you do it, you're going to put it on the nose, up on the forehead. So breaths are going in. What does that tell us?
Airway open.
Okay, so, but they're unconscious. So do they need airway management?
Yes,
please.
of course.
Just to stand back. We're going to measure, put it in. So pretend it's there. It's in there. And we're gonna. So when you guys do it today, you know, you would actually go put it on the forehead, pretend it's on the face. But it's normally here, right?
Yeah.
Good. So we're going to get a good seal here. We're going to breathe for the breath. 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000. Breath.
Okay.
I think you can do what I'm doing. Okay, so slowly, breath count 1,000, 2,000, 3, 4,000. Breathe. Think you can do that? So keep a good seal. Breath.
1,000, 2,000, 3,000, 4,000.
Good. So notice she's counting slow. I like that. 1, 2. Good job. My helper is effectively trained. Airways managed. That's blow. And she's only getting 17%, but she's blue and she's not breathing, so she needs more oxygen, right? Blow. Just remember, use everything in here before you move on to the trunk. Blow, and just flow, 10 liters. On exposure. So exposure, do I see any obvious injuries? Nothing right now. So we'll go sternum, must be hard. Ribs, rise and fall. Ribs, rise and fall. So the tummy should be soft. Usually we do that in the head to toe, but for the intervention for respiratory, we're doing the tummy as well. You're going to go underneath, sweep, make sure there's nothing underneath. Look at her hands. And we notice that There's nothing else found, so I've already now got A, good. I already have B, right? I checked B earlier while I did the trunk check. So C, the radial pulse is absent here. And it's also absent here, and this side's burned. So now we need to check the skin, pale cold. No, sorry. Once his radials are absent, I gotta make sure she's alive. So absent, carotid. And then we go on to the skin, pale cold clammy blue. And then we do a proper rapid body survey. Then we go down here. Oh, and we found, no, sorry, there's a hole over there. It's so burnt. It's a little bit of saline. Just cover it. Don't have to continue to cool it off. Exposure. Scissors are missing.
Behind you.
I can do that. And there's a hole in the shin there. Just cover it up. Sometimes there's actually smoke coming out of there. Really? Yeah, like especially if it's really new. Because remember, the reason they got it here is because there's a pole that's made all the way from here through. So when you see somebody's had a true electrocution injury, you see all these scars along where it is, and they, you know, if you look inside, you can see there's a hole. Like an electrical current went through their body. They don't usually make it if it's a serious one, right? Let's do it. Okay. So boom, boom, boom. Now I'll probably reassess. Thank you. So we'll do that one again quickly. Stay still, Dan. If you're having difficulty breathing, call 911, get back to me. Keep looking ahead, Dan. Come here. So look, what I have to first thing, check their back. And then clamp. Support his shoulder. Lay back, brother. So look at this. Do I have a good hold of your spine? Yes. Ooh. Okay, elbows to the ground. Elbows to the ground. Please hold the head for me. If he's difficulty breathing. Okay, so you're having a lot of difficulty breathing, bro. I'm gonna breathe for you. Breath, 1,000, 2,000, 4,000.
1,000,
Breath.
2,000,
So
3,000.
think I can do that for you? You said okay? 3,000, 4,000. Wait for him. Time. When I say 4, you inhale. 1,000, 2,000, 3,000, 4,000. Good. Blow. Blow. Don't piss off Pam, okay?
That's the last thing we need.
I can't even imagine him being upset. He's too chill, man. But I wouldn't want to piss him off. No. Expose it. All right. Oh, there's a hole right here. Okay, so now I still want to feel all the rest of the rib cage. So now sternum's hard, ribs rise and fall. Good. Tummy is soft. All right, good. Update 901. Oh, sorry. A, B, we already got that. C, good. And rapid body. I fell on you trying to lift your arm, man. Okay. Update, blanket, call it. Okay, folks.